We've heard a lot about the human cost of the opioid epidemic. According to the Centers for Disease Control, more than 106,000 Americans died from a drug overdose in 2021. Nearly 17,000 of those deaths came as a result of prescription opioids. The epidemic has also had huge economic costs to cities and towns across the country. And now many are in the process of suing businesses all along the prescription supply chain, from the pharmaceutical companies that make the drugs to the stores that sell them. Billions of dollars are on the table, but can that money help resolve the problem? Jonathan Vigliotti reports.
The streets where Sam Lawrence once lived may not look like an expensive San Francisco neighborhood, but there is a high price for living here.
This is what drugs took me to, you know. This is what I got. I chose this. You know, in a lot of ways, I didn't have the power of choice, but in some ways I did.
Drug addiction in San Francisco streets and hidden in homes would need $8.1 billion to rectify, according to claims made in a federal court case. The city of San Francisco sued drug companies, marketers, and pharmacies, alleging they get people hooked with legal prescription opioid drugs in the first place.
At the age of 18, started using prescription drugs, and it's just progressive. You know, starts out fun, occasional, you become dependent, and then you physically need the drugs in order to do anything.
Many also end up at the city's general hospital, which is why emergency room director Dr. Chris Caldwell testified in the federal case.
It would be hard for me to describe a greater crisis in medicine than what we face with the opioid epidemic.
What does that look like day to day for you?
So I don't do a shift without seeing multiple different aspects of the opioid crisis. So we'll see the acute overdose where somebody has taken too much, either intentionally or accidentally. We also see the devastating effects of long-term opioid use and what the patients will describe as such an intense need to get that high again. People sometimes develop an image of what they think of as a person with opioid use disorder, and I promise you that it impacts every type of background or area of life that you can possibly imagine.
Emergency care is just a part of the cost San Francisco City Attorney David Chu wants to recover, and his office reached a settlement with two opioid manufacturers, Allergan and Teva, in which they must pay $54 million to San Francisco over the next 15 years. Still pending is the city's case against Walgreens.
I've heard of doctors being pursued for their role in prescribing these drugs. It's not so often you hear pharmacies being targeted. Why go after pharmacies? And I imagine that there's some difficulty and challenges that you discovered along the way while pursuing Walgreens.
Sure. Well, we actually brought this lawsuit to go after the entire opioid industry. But specifically around Walgreens, I'll say that our lawsuit was a bellwether case, in part because it was the first bench trial, not only to find the opioid industry liable, but specifically to find the pharmacy Walgreens liable for what they did to our community among thousands of communities around the country.
San Francisco's opioid lawsuit is just one of 3,300 brought by state and local governments across the country to make the opioid industry pay up. And already there have been $54 billion in settlements. Most of the money is designated to addiction treatment and prevention.
The numbers are really like small parking tickets. They're really not creating any incentive for change.
University of Maryland professor Lisa Vertinsky studies the impact of large class action settlements.
So the money's largely going to address the harms that have been caused as opposed to being invested kind of in more systemic efforts to prevent that kind of harm occurring again in the future.
For Sam Lawrence, his days addicted to drugs and living on the streets have ended. But it was not because of legal settlements. He ultimately credits a support system of friends.
So I spent some years working with my buddy Quinn in treatment, and now I've made a transition into doing construction work. I spend time with my family, and I go to the gym, and I go to work, and I make sure to participate in my self-help groups. I help others.
And a settlement with Walgreens could come as early as next week. The company declined our request for comment. Teva, meanwhile, in a statement said its settlement is, quote, not an admission of liability or wrongdoing. For CBS Saturday Morning, Jonathan Vigliotti in San Francisco.